Hi, everyone. Thank you for joining us today for our webinar, Bringing the Preemie Home. My name is Ashley Randolph, and I am honored to be here today with all of you. I am a three-time preemie mom and the executive director for Glow Preemies and another organization called Alliance for Black NICU Families. And I'm also a dedicated advocate for Black NICU families. I've devoted my journey to empowering parents just like you and the ones you may be serving. Today, we're here to share resources and insights to make your transition from the NICU to home as smooth and safe as possible. This event is a collaboration between Glow Preemies, and Birthing the Magic. Both of our organizations are equally passionate about supporting families during their parenting journey. We're so grateful to partner with them in bringing you this information. Now, before we dive in, I would also like to invite you to our Winter Wonderland page on Glow Preemie's website. It's live through the end of the year and filled with holiday-themed resources, care box updates, and ways to stay connected with our community. And we will also share information about Birthing the Magic as well. House rules. Okay, so to ensure a smooth and enjoyable webinar for everyone, here are a few housekeeping rules. Please remain muted throughout the presentation to minimize background noise. Use the chat box to introduce yourself if you would like, as well as leave any questions that you may have. We will make sure to try to answer as many as we can at the end of the presentation. The webinar is also being recorded and will be available for replay, for revisiting, or to share with others after this is over. Now, introducing our wonderful guest presenter, I am thrilled to present Dr. Abobi. Dr. Alice Abobi is an associate professor at Baylor College of Medicine. She has over 30 years experience as a pediatrician and neonatologist and has practiced medicine in various clinical settings. She was born and raised in Ghana, West Africa, which I love, and has varied experiences given her unique perspective in health disparities and how it affects maternal and infant mortality in marginalized communities. Her current research interest is in the reduction of health disparities and neonatal outcomes for minorities, especially our Black babies, who are disproportionately affected. At BCM, she works closely with the Office of Institutional Diversity, Inclusion, and Equity as an Inclusion and Equity Ambassador. And in this role, she has been active in recruitment of medical students and mentoring of post-baccalaureate students who are underrepresented minorities in medicine. She is an expert on the effects of implicit bias and its effects in medical practice. Dr. Abobi has an MBA from Rice University in Houston, Texas, as a board member of Birthing the Magic Collaborative as well. She brings with her clinic and business experience, as well as a passion for the mission for safe birthing experience for mothers. Dr. Abobi, thank you for joining us and lending your time and knowledge to this important conversation. Let's get started. The floor is yours.
Thank you very much, Ashley, for this wonderful introduction. And thank you to all our guests who have joined us today. So I'm going to share my screen. Can you all see my screen well?
Yes, that's great.
Okay, good. So I'm going to talk about transitioning our babies from NICU to home, and I'm going to focus on safe sleep because that's a very, very important topic, and that's the topic where I see there are some differences that of what happens in the NICU as opposed to what happens at home. So as a neonatologist, I know of the effort that it takes to keep our smallest babies alive. And it is indeed devastating if such a baby is lost unexpectedly at home. So I made it my mission to ensure that all the babies who leave my unit had a safe place to sleep. NICU staff and provided modeled safety practices to acclimatize the infant and the family weeks before discharge, as recommended by the American Academy of Pediatrics. Sleep-related deaths are the leading cause of death in infants 1 month to 1 year in the US. 3,700 infants died from sleep-related deaths in 2023. And unfortunately, this number is increasing, and the disparities also is persistent. Now, this is roughly 1 in 1,000 babies dying. And that's just too much. Something needs to be done about it. We all know about sudden infant death syndrome. We all call it SIDS. In the 90s, there was a really, really big push to decrease the infant death from SIDS. And with that, we all know about the Back to Sleep campaign, where we encourage babies to be placed on their backs to sleep. There is another entity which encompasses SIDS, and that is the sudden unexpected infant death. So a sudden and unexpected death, whether it's explained or unexplained, including SIDS during infancy. Now with SIDS, that is when a thorough investigation has been done, including the scene investigation and autopsy, and a clear explanation is not found. So when we look at the sudden unexpected infant deaths, 41%, and this is data from the CDC, 41% would be from SIDS, and 31% from unknown causes. And accidental suffocation and strangulation in bed is emerging as a force to reckon with, because it's really increasing. When you look at this trend, you'd look at the 90s, and you'd see that the combined, what I would call SWED rate, was pretty high in the 1990s. Around 1992 is when there was the Back to Sleep campaign, and we can see how the numbers dropped by 96. It had dropped quite significantly. The campaign continued. Death from SIDS continued to drop. But there's something interesting happening. As you look at more recent years, from the year 2000, we can see that for the purple line, which is accidental suffocation and strangulation in bed, that's increasing. That's increasing. It was pretty low in 1990, but it keeps increasing, and that is not appropriate. That's something that is really sad. Something needs to be done about it. For all causes, since 2000, there's also an uptick. If you look at this graph, there's an uptick. And so it's important that we capture everything that we need to do to be able to prevent this. If you've had any experience, anybody you know, go through this, it's a very, very, very terrible thing. Now, when we look at this graph, which is also from the CDC, the orange one represents us, non-Hispanic Blacks, that our rates have pretty increased quite significantly. When you look at all the groups, our rates for sudden unexpected infant death from 2019 has increased quite significantly, and at a pretty alarming rate. Sorry. This is by state. You can see that southern states, Louisiana, Mississippi has the highest rate, Tennessee, Alabama, Arkansas, the dark blue ones, that's where the rate is highest. It is lowest in California, Washington, but when you take Texas, we are right there in the middle. And it will also differ by county. Sometimes when you look at a particular county, it might be higher in certain areas. Now, when it comes to our NICU patient, our preterm babies have a 2 to 3 times, they are 3 to 3 times more likely to die from sudden unexpected infant death. So it is important that we transition from our therapeutic sleep positions, which we do in the NICU, to safe sleep practices before discharge. So in the NICU, you would see different kinds of positioning. We encourage kangaroo care, which is very important for mother and infant, where the mother is against the baby is against the mother's skin. It helps with bonding, temperature control, physiological activity. Prone positioning is also helpful with acute respiratory disease to improve oxygenation and lung function. There are certain upper airway abnormalities. There are also certain facial abnormalities where the babies are kept prone. Babies who are withdrawing, in order to control their symptoms, you might find them in different positions. And sometimes you can see that what you see in the incubator would be just different. You see babies with positional devices being used to maintain proper position and comfort, and some of them are just for physical therapy issues. All these babies, however, are on continuous monitoring in the neonatal intensive care unit. And some of what you see in the NICU, which some babies might get used to, are not appropriate for home. So it's always important to make sure that once the baby is ready and physiologically ready, we transition that baby. AAP, the American Academy of Pediatrics, puts this around 32 weeks. If the baby is physiologically stable, that we begin back to sleep. We begin to think about placing our baby in those safe sleep positions. So what should NICU staff be doing? We need to model the safe sleep practices after 32 weeks if the baby is medically stable and without acute illness. We need to provide family-centered care with what I call provider-parent partnership. We need to develop policies in the NICU and protocols and procedures about safe sleep. Many NICUs may just give it's like a checkbox that they check off that they provided safe sleep education without really going into detail about it. But this is a very important point. We need to educate and ensure staff and provider buy-in. There are sometimes even our own NICU staff and providers may not have that buy-in as to whether the baby is ready to transition to safe sleep. And that buy-in is important. And we need to make safe sleep a part of our daily rounding, educate parents continuously, answer their questions, and educate them about CPR for babies. Now, what about the role of the parent and the caregivers? For the parent, they need to be actively involved in the daily NICU cares and to know their baby well. The use of human milk feedings for babies cannot be overemphasized enough. We need to avoid smoking during pregnancy, the use of marijuana, alcohol, any illicit drug use, both during pregnancy and after the delivery of the baby. We need to make sure that we do have a safe place for the baby to sleep before the baby comes home. And you have to have the appropriate federally approved crib or bassinet for your baby. And if you don't have that, to let your social worker be aware of that so that you can have help. We need, even in the NICU, to be sure that we are consistently practicing placing our babies in the crib on their back, even if they fall asleep in our arms. Overheating is to be avoided, and we need to practice supervised tummy time. So these are things that you can begin to do in the NICU before your baby actually comes home. So the ABCs of safe sleep is still very relevant. A baby alone, not with other people, no blankets, no stuffed animals on their backs and in their crib, and not in an adult bed, not in a sofa or cushioned area or another soft surface. So just beyond the ABCs, what else? These are recommendations and from AAP. It's back to sleep for every sleep. The use of a firm, flat, uninclined sleep surface for the infant. The bed must look boring. No bumpers, just a firm, flat surface, very well tucked in, nothing sticking out. Not the bed should not be placed around any curtains, nothing fancy, just a firm, flat surface for the baby to sleep in. The importance of sharing the room with the infant on a separate sleep surface close to the parents, and that would be co-sleeping. Avoiding soft objects, pillows, loose bedding from the sleep area. Again, avoiding nicotine, marijuana, alcohol, opiates, illicit drug use, both during and after birth. Avoid overdressing. For our NICU babies, you might see even in the NICU, sometimes the babies have head coverings on, but as they are going home, if you are comfortable indoors, the temperature that you have indoors, that you feel comfortable, the baby should not have more than one extra layer. And a head covering, if your home is comfortable to you, it's not usually necessary. Breastfeeding or use of human milk is highly recommended. Offering a pacifier at bedtime after breastfeeding has been established is helpful. The use of cardiorespiratory monitors, over-the-counter ones, as a strategy to reduce the risk of SIDS is not proven. It's not been proven that these monitors reduce the risk of SIDS. So we don't necessarily recommend them. If you use it, we don't want you to feel confident, overconfident about the fact that you have a monitor. You should still follow safe sleep guidelines. And therefore, and also knowing your infant CPR and when to seek emergency attention. So these are illustrations of what could happen. You see the soft bedding, that baby is in an unsafe, she's prone. There are too many pillows in there. The baby has a teddy bear inside the bed. The bedding is soft, so it's unsafe. This is a mother sleeping on the same bed as a baby, and there's an overlay. And then this is the baby sleeping on an adult bed who is entrapped. So entrapment can happen, and that's what causes the suffocation. So the safe bed looks more like this. Is a baby on its back to sleep, wearing a sleep sack, very plain, firm-looking mattress, as opposed to the other picture, which is unsafe. The baby's on a pillow. There's a blanket, a loose blanket over her, and there's a teddy bear in there. And we also have these bumpers. We don't need any of that. The more boring the bed looks, the better. Another common sleep position that a lot of people, and especially sometimes even in our communities, in the Black communities, is putting the baby prone, because we think that the babies sleep better when they are prone. And also we think that it's better if they spit up. But if you look at these pictures, you would see that the upper arrow shows the tube to the lungs, which is called the trachea, and it is higher. And the lower one is just behind it is the esophagus, the tube to the stomach. Now, in the baby who is sleeping on the back, if that baby spits up, and feeds of food pulls in the throat and in the mouth and it's coming down, it would go by gravity, it would go into the lower tube, which would be the esophagus. As opposed to the baby who is sleeping prone, if that baby spits up, the normal track that the food when it's coming back down would be to go into the trachea. And that's going into the lungs, and that would make the baby aspirate. The babies also would have their own mechanism trying to cough, but the chances of aspiration is actually higher when the baby is put prone, as well as when the baby is put on the side. So placing babies on their backs to sleep it remains the recommended sleep position. Now, I just want to share a little bit about the research that I did in my unit. And this is just this was a quality improvement effort where we did audits to show how we can make sure that our babies are in a safe sleep position and that this becomes culture in the unit. There was a big improvement, but you can see that even in the medical setting, we could not achieve 100%, but we did make significant improvement. And I'm happy to say that it has become cultural in our unit, where everybody is invested in keeping babies in a safe place to sleep now. And we actually have a card by the patient, by the baby, when it's time to be in safe sleep position, to remind everybody to ensure that we are practicing this, to model it for our babies. This also shows the improvements that we made in putting babies supine, that we achieved 100%, making sure the head of the bed is flat. That was really required a lot of education, even amongst medical staff. So I can really understand if a mother has a baby who supposedly has reflux, they want to incline the head of the bed. And even in the NICU, it can be a bit of a challenge getting everybody to understand that that is not the best way, because the babies can slide down, and when they slide down, they can change their positions and it becomes unsafe. No objects in the crib. In the NICU, you can see objects in the crib sometimes. We achieved a significant improvement in the use of positioning device, as well as taking away all soft blankets. So I know that I call this the fun part, because I know that there are lots of discussions about what is the recommendations are about safe sleep and what people actually practice and the difficulties that are involved. So I thought we would go a little bit into these. So co-sleeping typically would refer to you can co-sleep in the same room, which is really recommended, but your crib or your bassinet should be just next to your bed, and so that you can reach your baby without having to get up. There is a lot about co-bedding online. People really do say that the recommendation about not co-bedding is not realistic. Most babies end up in the bed with their mother, but there are many reasons why it is not recommended here in the US. If your bedding is soft, you can actually have a dent. If you have an old mattress, your bedding is soft, you have a sleep number bed or whatever kind of bed, that bed might be too soft. You might have an indentation in the bed whilst you're sleeping with the baby, which would, most adults would sleep with sleep coverings. It can easily cover the baby's respiratory area and cause strangulation and suffocation in that baby. If the mother is tired or the parent is tired, you can easily roll over your baby and cause an overlay. In fact, if you are using any medications which would make you overly tired, that can also increase the risk. These risks can go up to 10 times. If you're smoking or have smoked during the pregnancy, either using marijuana or using cigarettes, all those risks go much higher. And so the risks are real. There is research to back it. There are many people who talk about other cultures, co-bedding, and yes, they do, but they may not have everything is cumulative. Some of them are sleeping on the floor. Some of them are sleeping on a firm surface. There are no medications involved. So it is understandable, and the AAP is listening. It's not to shame any parent, but if you're a parent and you feel like you need to co-bed, please discuss with your pediatrician. You can discuss the circumstances around which what your understanding is, so that it can be safe for you. Swaddling is another thing. We tend to swaddle newborns a lot. If you go to any birthing unit, the babies are all beautifully swaddled. It makes the babies comfortable. The important thing about swaddling is not to swaddle too tight. And once the baby is old enough to roll over, you shouldn't be swaddling that baby. The baby should have, however you swaddle, the baby should be able to move their arms a little bit more. You shouldn't swaddle that tight that the baby cannot move, especially if it's not a newly born baby. You shouldn't swaddle them that tight. And after 4 months of age, swaddling is not really recommended. There are lots of sleepwear that are available. Instead of using a loose blanket, you could sleep in a sleep sack, and that can be very cuddly for the baby. There are all kinds of sleep sacks available which can be recommended. Another new recommendation is the use of head covering and hats. If the room is comfortable, when you bring a newborn home, the temperature around 72 to 74 is usually comfortable enough, and it's comfortable for you. Just one extra clothing for the baby should be fine. And the use of hats is not particularly recommended. And you also should be careful the kind of fabric you use, that the clothing is made of, so that it doesn't overheat the baby. Overheating the baby can be quite dangerous when unintended death is concerned. The pacifier use, yes, if you are breastfeeding, it is recommended that you don't use a pacifier until breastfeeding is established, but that's just in the first few days. After that, you can use a pacifier at nap time. And immunization is also important, and to make sure the baby doesn't get sick. And so that's just a few pointers, and I'm opening the floor for questions and discussion.
Thank you, Dr. Obobi. That was wonderful. I have learned a lot. And as you know, I'm a three-time preemie parent, so thank you for that. If any of you have any questions, feel free to put them in the chat now, and we will go ahead and answer them. But while we're waiting on that, so I wish I had you when I had my kids. This would have been so helpful. I have a few questions of my own.
Yes.
So I heard you say at the end that 72 to 74 degrees, I believe you said, was like a good temperature. Would that be the same temperature for when they're going to sleep as well?
Yes, that would be the same temperature for when they're going to sleep. Yes.
And then another question I had, you kind of touched on it. Um, should they be using sleep positioners or wedges to keep the baby on their back?
No, sleep positioners and wedges are not recommended. We do know that physiologically these babies are going to roll over around 3 to 4 months of age, usually around 4 months. So if you put the baby on their backs, and if the baby is active and rolls, then that's fine. It's just physiological positioning for them. But when you are putting them down to sleep, still put them on their back. It's okay if they are maturing, because they will be maturing with time. The peak time for SIDS is 1 to 4 months, and babies at 4 months can roll, so the risk is lower. So if they themselves roll, then they've rolled. You just you leave them alone. Yeah.
Okay, let them do their own thing.
Yeah.
Um, when is it safe to transition a baby from a bassinet to a crib? I personally had all my kids in bassinets until they couldn't anymore fit in them.
Yeah. I think that it's just a matter of size and convenience. So long as the surface is flat and the mattress is firm, It's fine. Usually, for co-sleeping in your room, if you want the baby just by your bedside, then a smaller bassinet, a pack and play bassinet is fine. You can very easily reach your baby. The baby cannot roll yet, so you can you can just reach to you can put the baby right by your bedside and reach for the baby, so you are not disturbed. Um, but if, let's say, you don't have one, you just have a crib to start with, then that's what you use. You keep the baby in your room. For the first year of life, it is recommended that the baby is in your room. Definitely, when the baby begins to be more active and to roll around, the risk of falls are higher. So then you would want to be in a crib, so the baby that just doesn't, try to climb out of it. Some babies actually try to climb out, and so then
Yeah,
it yeah, bassinet.
I have seen that. We do have a question in the chat. Are there specific guidelines if my preemie is on oxygen or has other medical equipment?
Yeah, if your preemie is on oxygen, even that makes it even more important for you to keep the baby on their back. You don't want the baby will have a cannula in. You don't want the baby on the side or prone for that to actually be a form of obstruction. So even if your baby is on oxygen and has a cannula, you should keep on their back. Some babies are medically complex and they even have a trach and it's on a ventilator. Those babies should be on their backs as well.
Um, okay, another question. How soon after feeding can I safely lay my preemie? Oh, can you hear me okay?
Yes, I can.
Okay, because it said I was muted. Sorry. How soon after feeding can I safely lay my preemie down?
So after feeding, you want your baby to have a good burp during the feeds. Usually when you're feeding, uh, they swallow a lot of air. They can spit up easily with a wet burp. So make sure the baby has burped well. Now, if your baby has a lot of issues with spitting up, you can hold them upright for about 10-15 minutes and let them burp well and get adjusted to the food, and then you can lay them down. And then they will learn to use protective mechanisms of their airway when they spit up to close up their airway. And like I said, if you are lying prone, you will be able to protect your airway better. Yeah, sorry, yeah, lying on your back, you can protect your airway better.
Now, I have a good question for you. Um, a lot of my friends, some of them are still having babies now. Some are preemies, some are not. And I think this question goes for overall. What do you say about when the preemie baby is in a car seat and has fallen asleep, and parents don't want to move the baby because they don't want to wake them up? Do you recommend they keep them in the car seat or no, safely move them to where they should be laying on their back?
That's a very important question. Yes, when they have fallen asleep in anything other than that flat surface, move the baby. Don't let the baby stay in the car seat. The car seat is just for traveling. If you're a preemie parent, you know that even before your baby leaves the hospital, we do a car seat challenge. And when we do the car seat challenge, we are the baby in that crunched up position. We want to make sure that they can oxygenate well. And sometimes the oxygen levels actually drop in the car seat. So it is not safe to keep them in a car seat. We do the challenge to make sure that it doesn't drop. But sometimes it does drop and we say, well, they failed the car seat challenge. So that inclined position is not the best position. The same goes with if you are, so some people say that, okay, we can't feed the baby at night. They say we shouldn't put a baby in a bed, so I'm going to get up and sit in a couch or sit on the couch or sit in a rocking chair. And if both of you fall asleep, that's very, very dangerous. It's actually better if you are in the bed and you feed the baby, you put them, you put the baby right there than to feed the baby on a couch or in the bed. Another common finding is And it looks really nice when the fathers have the babies and on their chests and they're sleeping together. It looks so nice. It's like the father is taking care. That can be dangerous too. So you need to move that baby, even if the baby is sleeping prone. Usually they are sleeping prone on their father's chest. It's just so cute, but it's not safe. So that should be discouraged. So even if you're feeding the baby on the couch or in a rocking chair, please make sure you put the baby down. If you are too sleepy, it's actually safer to be in bed than to be in a couch feeding your baby when you fall asleep.
I love those ideas. And thank you for reinstating what I thought that we should be doing. So thank you for that. We do have a question in the chat, and I think you kind of touched on this earlier, but they do want to ask again. You said not to overheat. So the ideal room temperature for the preemie sleep environment should be one more time for us.
72 to 74.
74. Okay.
Yeah.
Um, Now I have a burning question. You had mentioned about smoking and cigarettes and marijuana and all of that.
Yes.
I live in a state where that is legal.
Mhm.
So, what do you recommend for, let's say, mother? Let's say she doesn't do that activities, but
Yes.
father does, and father likes to put baby to sleep at night. How can mom gently encourage dad to, you know, I don't know, would you suggest not smoking within like an hour before putting baby to sleep or changing clothes, or what would you recommend? Of course, we would just rather them not do it at all, but
Yeah,
if they're
we'd
in the
rather not
situation.
do it at all.
Yeah.
And so for the babies, for the fathers who smoke or anybody else who might be helping you take care of the baby, they also must follow safe sleep guidelines. It can be a grandparent, it can be anybody who is involved in the care of the baby. Fathers particularly, and I know that marijuana use has become very common. But fathers are so important, even in the development of the baby. Um, Even before pregnancy, fathers are important for they themselves. So for the young woman who is planning to have a family, start a family with a male who is a habitual smoker, it is important to let them know that you need them to stop, even even before the conception, because it actually uh, it's not good for the baby even during uh, the pregnancy. The placenta, this was a fact that I just, as I was looking more and more to the role of fathers, everybody thinks the mother does everything. Yes, we do most of it. But the father is actually responsible for the fetal side of the placenta, how healthy it is. And when you smoke weed, that affects that side, even affects how healthy the baby can get nutrients from the mother, because the father controls that. The father's genes and the paternal genes control that part. So we need to let them understand that if we are going to have children with them, they should stop. We should encourage them not to be habitual smokers if they are ready to have babies, because even during pregnancy, we need them. We need them for us to have healthy babies. So it's very important that they don't. And definitely, I wouldn't even put a time to it. If you smoke, you smoke. Stop smoking. Stop, just stop it. It's not good for the baby. If you are ready to be a father, then you really should stop.
I guess
Because it is
this would be a good time to say no smoking in the car with or without the baby in the car.
yes, no smoking in the car with or without the baby. Yes.
Yeah,
Yeah.
a lot of people
But the
think it's
one is,
okay, but it's
if you're
not.
going to be a passive smoker, if you live with somebody like that, the mother becomes a passive smoker. She's going to, and all that affects the smoking is actually very unhealthy for a developing fetus as well as after delivery.
Um, and then let's see. I had another question to follow up with that, similar to the smoking. No sleeping in the car seat, which is amazing. We touched on that. Sleeping in like a baby carrier or um, let's say like a baby swing. I was trying to think of the name of it. A baby
Oh,
swing. I've seen that as well. So the same
yeah.
thing. If it's not on their back, don't leave them.
Yeah, they fall asleep and pick them up. I know that practically speaking, some babies are very, very hard. And even our NICU babies, sometimes you see the
Yeah.
babies in the swing, the NICU. Yeah, but when they fall asleep, pick them up and put them on their backs to sleep. Yeah.
I have seen some things, and I've seen it with a lot of preemie families now. How do you feel about people putting, I think it's like a vaporizer mist type thing in the babies' rooms to help them, I guess, sleep better? I'm not sure exactly what it's supposed to be used for, but do you know kind of what I'm talking about? And do you suggest that to help babies sleep?
Like people put humidifiers sometimes.
Yes.
I think it air purifiers. We don't have a recommendation for that. Anything that is using liquid, you have to be careful that it doesn't begin to harbor any kind of bacteria or virus that then disperses into the air and then it defeats the purpose. So we need to be careful with those things.
That makes perfect sense. Thank you for covering that. Um, so I have another question, burning question for me. Um, so I was a preemie parent, 3 times, and my kids are older now, but I still find myself in the middle of the night going in to check on them as if they're still in their bassinets or in the NICU. To stop that trauma, because my
Mhm.
oldest will be 14 next week and I still do it for him. To stop the year-long trauma of other parents having to do that, would you recommend them getting baby monitors when they finally do have the baby outside of their own room so that they can keep a watch and hear if anything goes on?
Yeah, you can have a baby monitor. The caution is that you shouldn't fully rely on that baby monitor to be to be what is going to let you know about if something is going wrong. Because you need to practice all your safe sleep tips. That's the most important thing. There shouldn't be an over reliance on the monitor, and then you relax about other safe sleep tips. And yes, it's technology and people are going to use it, but
Mhm.
don't over rely on it. If you've used one before, it can be pretty annoying and you might end up in the ER unnecessarily many times and it's quite expensive when
Oh
the
no.
monitor goes off and you you rush to the ER even when the baby looks fine. But it's you can't stop technology, but it does not prevent it. So don't let that give you false assurance. But I
Oh.
understand if parents want to use it, but they shouldn't be think that that's it. They can relax about everything.
And I know you also talked about using a pack and play or a playpen as some people call it for their babies is okay. And um, a lot of times I find that the parents think that they shouldn't keep their baby in there, but you're saying it's okay if they don't have a
Okay,
crib setting yet.
especially if let's say you have to take your baby to a grandmother or some other place, you can't control the environment there. Maybe at home you have your crib, but it's good if you take your own sleep place and say, put my baby in this to sleep, so they don't end up on an adult bed or in unsafe situations. It's better to use that. And it's very much it's okay to use to use the pack and play. It is safe, it is flat. Now, there are some federal guidelines about the safety of different sleep surfaces, so you can always check it online and to make sure that whatever you are using is approved for safe sleep. Yeah.
Oh, that's important.
Yes.
Okay. Yeah, that's very important because I have seen some recalls over the years of
Yes.
items, and sometimes they will still be up for sale at the stores.
Right.
So you are very correct. Thank you for mentioning that. Um, Yes, monitors are fine, but please don't let them give you a sense of false security.
Yes.
That's in the chat. So yes. So I know we only have about 12 more minutes with you, Dr. Abobi. Is there anything else that you just think that preemie parents should absolutely know? Um, or any like last words of encouragement during this transition? It's never an easy transition for parents. I
Yeah.
hear it all the time. It's probably the most scariest times.
Mhm.
I personally, um, each time, so by the third time, I didn't get that much support from the NICU staff because they said you already went through it 2 times, so you're a pro. And I was like, oh my gosh, but it's still, the feelings are still there. Um,
Yeah.
and when you first have a child, and let's say it's a regular pregnancy, and everything's happens, you're expecting to go home. And so
Yes.
talking about false security, when you have a NICU child, you kind of have that false security because your baby is there with healthcare professionals for X amount of time. And
Right.
when they say, okay, now you're taking your baby home, there won't be no doctors, there won't be no nurses, you probably won't have a monitor, you have to figure it out.
Yeah.
It's like, oh my goodness, it's all on me now. Um,
Yeah.
and it gets scary. Um,
Yeah. Yeah.
what do you say to those parents who are transitioning? Any words of encouragement?
Okay. The words of encouragement I'll give them is that for us, the NICU doctors and the NICU staff, we will not send you home with a baby who we think is unsafe for you. So we will make sure that the baby is well monitored, the baby is feeding well, and we have observed the baby really well before we send that baby home with you. Now, some NICUs actually offer what we call rooming in. Not all NICUs do. It's a very busy NICU, they don't offer it. But if you're in a community setting, many times they actually might be able to offer that to you. So you can ask for it if they offer it. And that would give you the one night experience of being with your baby without the monitors and actually learning to know the baby. Just with the assurance of having the NICU staff just around the corner for you. Another tip is that get involved with your baby, get to know the baby. So from the time that the baby, because the babies are going to have, if you have a premature baby, there will be that time when they are pretty stable and all they're doing is learning to eat. Be there, do the feeding, do the burping, do the changing of the diapers, learn to know that baby very, very well. Don't come in for one visit and one feeding, and then here you are with a baby. Just make time for that. Come in, bring a book, come and feed, and sit there.
Yeah.
I know that's not possible for everyone because sometimes our mothers are working and they're actually trying to work whilst the baby's in the NICU so they can have time whilst the baby goes home. It can be quite complicated, but as much as you can, spend time with that baby to know the baby because that's going to help you when it's time to go home. And make sure that you also choose a pediatrician and visit the pediatrician's office and make sure that the pediatrician is very comfortable taking care and also very, they should choose someone who's used to taking care of ex-preemies, who is comfortable with them and who is patient and will have time for you. That's important. So if you have the opportunity to do that, don't just choose somebody and then go for the first visit. A lot of pediatrician offices would offer you like kind of a first visit even without the baby. So if you can do that, take advantage of that. And make sure you don't need a special room for that baby. I know it's very beautiful to have that baby room, but babies don't need that much. They just need a lot of love and care. And so you just need make sure you have your crib or your bassinet right next to your bed. Few things, you don't need too much. You can decorate your a room if you want with the teddy bears and all that
Yeah.
people give you, but they don't belong in there
Yeah.
with a baby. Yeah, so I think an important thing is knowing the baby well and
Mhm.
being in the NICU as much as you can to know that baby. Yeah.
And I love that you brought that up because you actually can learn your baby's sleep pattern
Mhm.
before you even go home if you knowing what to look for.
Yeah.
So I didn't know that the first two times, but the third time I was recognizing, okay, well, she likes to sleep for 2 hours at a time, and it was
Right.
usually around the same time. So um that's like the best advice I could give a parent from a parent. Let you learn their sleep cycle before you go home. That way when you go home, it's just part of your plan, and just trying to keep that similar schedule. Another good point that you brought up, it was towards the end about the pediatrician. Oh,
Yeah.
I love that you brought that up. My first child, I did not know that knowledge, and the pediatrician did not have experience with NICU children.
Oh,
And so I truly, truly am grateful that you did bring that up to the families because that is very important. And I did not know that sometimes you can meet the pediatricians before you even leave the NICU. So that's a great fact and tool for parents to use.
yeah.
Um, we also have in the comments, someone wrote, also be careful of infant items sold on secondary market like eBay, etc., as they
Yeah.
may have been recalled, which is another great point.
Very, very, very important. Yes.
Yeah, very, very important. Um, I thank you for everything that you shared with us today. It was an impactful and amazing presentation. If I have any last words, it's just thank you for what you do and for helping teach all of us the knowledge that you have, from professionals to the parents, because we need you. So thank you. And how do you think, this is just a guess, fun guess at the end, how do you think the rates will look for this upcoming year when the new data comes out? Do you think it may be lower, kind of the same? And then my second part of that question is, are you guys still doing research at your facility?
Oh, okay. So we did let me answer the second question. I did this research and it became cultural to us at the facility, and we took it to other hospitals. So currently, yeah. So currently at our biggest hospital, which is Texas Children's Hospital, it is ongoing. So that's a good thing. And yeah, what was your first question?
The data, do you think the data is going to change for when the new results come out? I'm sure it'll be next year sometime for this year or 2023. I don't know if 2023 has came out yet.
Yeah, I unfortunately I don't think so. That it's on that trajectory, and new guidelines, AAP recognized that and brought out newer guidelines in 2022, and it usually takes time. And there are also, with the advent of social media and everybody being an expert and the distrust of the medical community, I think that it's probably not going to be different, but we might, if we do more sessions like this and it becomes part of, we need to make a push for it the way the push in the 90s was. We need a real major push to change the direction, because it's rare enough that people wouldn't know anybody who's experienced it, and so it's very far removed from them. And so if it hasn't happened to you, then you don't care about it. Yeah.
Mm-hmm.
But if it happens to anybody you know, or it's a devastating thing to put a
Hmm.
baby down to sleep and to find out that the baby has passed.
Yeah.
It's just unimaginable pain. So
Yeah.
I'm hoping that there'll be a change, but I doubt if that would be this soon. I think we need a big push to change it, especially the strangulations and the suffocations. Yeah. We
Hmm.
unfortunately breastfeeding is great. That's what we recommend, breastfeeding. But sometimes mothers are so tired, they fall asleep on a bouncy chair or a rocker with their baby in their arms, and then it causes entrapment, and so just lots and lots of teaching and a little bit of trust in that the science is right, instead of
Yeah.
the influencer is right.
Yeah. And it is devastating and it is life changing. I've dealt with a couple of couples who have had unfortunately happen to them, and it completely destroyed their relationships afterwards too. So it literally affects the whole family as a whole. And yeah, I'm so glad you did bring that up. And if any of you have any questions that we didn't answer today, please feel free to talk to your physician if we have families here. And if you are a professional and you would love to get to know more about Dr. Abobi, I'm sure we will be sharing her information as well. She's amazing and once again full of knowledge. That's all the time we have for today for this webinar. I do want to say thank you once again, Dr. Abobi, for everything that you did today and the beautiful presentation and your knowledge. Thank you to Birthing the Magic Collaborative for working with Glow Preemies on these special webinars that we've been doing this month. And I hope you all have a wonderful evening. Dr. Abobi, do you have any last final words before we say goodbye to everyone?
Well, I want to thank everyone who joined us. Thank you for the participation. Thank you for being such a wonderful audience. Spread the news about safe sleep. Be an ambassador for safe sleep so that this becomes a never event.
And I agree with everything she said. Have a good evening, everyone.
Thank you. Thank you, Ashley.
You're welcome. Thank you all.